We're all in agreement this summer's fire smoke was among the worst in decades, with Missoula County surrounded by fires burning hundreds of thousands of acres. And now the first results of a report by the Montana Department of Health and Human Services is confirming the smoke was making a lot of people sick enough to send them to the hospital.
Looking specifically at people who had complaints of cough and asthma, shortness of breath, wheezing, and other symptoms of smoke-related issues, they found that compared to the same time period in 2016, which if you recall was kind of a quiet smoke year, we don't have much smoke, there's a 2.3 times increase in the number of people going to emergency departments for those respiratory-related issues.
This state report is separate from a specific study by the University of Montana analyzing the fire impacts in Seeley Lake. And Cofield says the number really doesn't come as a surprise because health officials have been hearing reports all summer of people being sickened by the choking, never-ending smoke day after day. But it's useful because of confirmation of what they're hearing with hard numbers based on zip codes for Missoula and Powell counties.
There's a lot of ways you can take this and look at it more closely and parse some different things out. But from just a very first broad look at it, there was a definite increase in the number of people going to emergency departments with respiratory concerns.
This report, along with the study and other research, is going to help the health department and other agencies as they consider ways to modify the warning system so advisories can be more useful in years when there's extreme fire smoke.
It's sad that we can see such a clear uptick, just because it means that many more people were suffering compared to when there isn't smoke. But it is also nice to have the science and understand what was going on, and hopefully that will give us some good information for going into future smoke years on what we can expect.
In Missoula, Dennis Bragg, MTN News.